People with disabilities have the same sexual and reproductive health needs as others, but often face barriers to information and services. They should be able to speak openly with medical providers on issues regarding sexual activity without the fear of discrimination or availability of options. Even in a professional medical setting, talking about sex can be awkward and uncomfortable. Here are some tips for providers and patients. Providers always speak directly to the patient when asking sexual information and discussing contraception and other available options. Your personal opinions or those of the patient's family members should never be a factor. Patients with disabilities should receive the same treatment and prevention options as those without disabilities. You should also feel comfortable discussing alternative options for individuals to engage in sexual activity. Remember, it's never okay to recommend terminating a pregnancy based solely on disability or to assume that people with disabilities won't engage in sexual activity. Patients with disabilities might need some pointers too. First of all, acknowledge your discomfort. A good way to start the discussion is with a question. It's not the most comfortable topic, but could we please talk about sex for a minute? Approach the topic from a health perspective. Say, I'm concerned about thyroid problems because my interest in sex has dwindled, or I'm having discomfort during sexual activity. Could this be due to medication? A doctor's visit can be nerve-wracking enough. Put your questions in writing so you won't forget what you need to say. Understand your body and your medical needs so you can explain what you're looking for in terms of contraception or specialists dealing with fertility. The bottom line, it's okay to talk about sex. Patients should have the confidence to discuss their needs and wants with medical providers, and providers should encourage patients to speak up when they have questions or need resources. A successful doctor's visit doesn't just happen. It takes some planning in advance. No matter what the situation, here's how to make the most of your next doctor's visit. If you need accommodations during your medical appointments, remember to request those accommodations at the time of scheduling. A few examples of accommodations include an adjustable exam table, a sign language interpreter, or assistance with completing paperwork. During your visit, ask questions regarding any treatments, tests, or medications you don't understand. Write down your own questions beforehand and list the most important ones first to make sure they get asked and answered. Remember, you are the patient. Unless you choose otherwise, don't let others speak for you. Make sure your provider speaks directly to you and not a companion or family member. Ask your provider to draw pictures or show a model to explain a complicated treatment or diagnosis. Take notes or ask for written instructions. Bring an audio recorder or assistive technology if needed. Whatever works best for you. Ask for brochures, audio recordings, or visuals to help you understand. Let providers know if you need assistance or have questions about medication. For example, you might need a medicine bottle without child protective lids, a pill crusher, or even liquefied medication. If you're waiting on tests and haven't heard from your provider in a reasonable amount of time, call them back and ask for your results. Be proactive about your health. And remember that you have the right to choose your provider. If you're not getting the help you need, you can always choose a new provider. People with disabilities are sexual beings and deserve access to information and resources to make good choices about their sexual and reproductive health. All people have the right to receive the highest standard of sexual and reproductive health care services. Other rights include access to sexuality education, the right to choose their own partner, the right to choose to be sexually active or not, the right to decide whether or not and when to have children, and the right to pursue a safe, satisfying sexual life. When it comes to sexual health and reproduction or any other issue, disability does not affect your right to make decisions or informed choices. Communicate clearly and ask providers for exactly what you need. They'll be glad you did, and so will you.